Guess who's back? Back again. Guess who's back? Tell your friends. Yes, I was back at Mayo Clinic again recently for some crazy GI testing that spread over the course of 3 full days, and that's what I'm going to dive right into today. Yeah, no pun intended. I want to get into the different tests that I had to have done because aside from one, maybe two, I don't think a lot of people are very familiar with them or that they're done very often. And I had a hard time finding any kind of like first account experiences or what to expect that way. So I kind of had a lot of nerves going into them that I don't really think was beneficial since I was kind of like imagining worst case scenario in my head. So that's basically the purpose of this video is I'm going to explain each of the tests that I had. And then of course at the end, I'm going to tell you what the results ended up being. And then when I met with my GI doctor afterwards, kind of what my results, my new diagnoses are, and kind of what the next steps are going to be. So without further ado, let's dive right in. If you're new here, I am Heather. This is my channel, Heather's Hikes and Adventures. And I am trying my darndest to get back to hiking and adventuring. And so at the moment, I am currently very desperately trying to heal myself, but there are still questions that need to be answered for the best, outcomes. So that's what this, let's just get into this, shall we? I'm going to stop setting it up and let's just start talking about the tests. By the way, I 0 out of 10 recommend getting an esophageal manometry. Was not fun. Do not recommend. Would not voluntarily do again. They stick this tube up your nose, down into your throat, like all the way down into here. And it was not tiny like I assumed. It was like, yeah, I did not like it. It looked like they were shoving a big fiber optic cable down there. And then I had to drink water and like swallow every 30 seconds and then rapidly swallow salt water, all while that thing was in there. That did not feel good. My throat doesn't feel good anyways on a good day. Like I said, do not recommend. But we'll see if it tells us anything useful. So as you can see, test number 1, not so much fun. 0 out of 10 recommend, just like past Heather said. And just to kind of expound on what she was saying, basically what they do is take what looks a lot like a little fiber optic cable and they just go up one nostril, kind of like the ancient Egyptians. And then down into your throat, past your, esophagus, all the way down basically to make sure that there's no lesions, there's no, signs of masses, nothing super emergent, no erosion. They can confirm certain disorders. So the part that takes it to a whole nother level is I should probably explain that I already have major issues swallowing, which is one of the reasons why these specific tests were ordered. And with the esophageal manometry, what they try to do is see where the defect is, if there is an actual issue with swallowing, and kind of what that issue might potentially be. So picture that you're already having a hard time swallowing and That's what she said. Okay, that's the one and only time I'm going to say that this time, I swear. I'm going to zip it no matter how many times it pops in my head. But just getting the scope in place takes a few minutes because they have to kind of slowly ease their way down as your muscles allow. And then that's when the real fun begins, because you have to start sipping water. To different degrees, they'll take you to take a sip and then hold it and then swallow it. Then you have to wait 30 seconds and then swallow again, and so on. They have all these different types of things they want you to do, and then you have to start sipping salt water, and then they'll have you take a bunch of rapid sips to see what happens there. All while this fiber optic cable, I don't really know what to call it. It's a scope, but it seemed much more significant than that. So keep in mind that you're having to do all of this while you have this sizable scope down your throat, and you're having to swallow, breathe, you know, all of those things, when I have a difficult time doing that with nothing down there. So to say that it was unpleasant would be an understatement. I do see why it's important, and they did determine a lot from it, so it was definitely not in vain. Again, I'll get into that at the end of the video, what all of my results and diagnoses are and everything. But it's not so much that it's painful, although it wasn't not painful, but it was just very uncomfortable. You kind of feel like you're choking inside and out. And it may be different for other people that have different issues than me, and maybe don't have as much difficulty swallowing, but that is basically what you can expect during an esophageal manometry. I also learned, fun fact, that they have anal manometries. Don't ask me how I found that out, but you might find that at the end, which, as you can imagine, is basically the same thing, but in reverse. So, moving on to the next test that I had. I also want to quickly say that after Tuesday around lunchtime-ish, I had a very light lunch when I found out that I did not need to do the extended prep for my Thursday test. I was allowed to have one meal in between all of my testing, but it couldn't be like something really heavy. So I ended up with a cup of soup and a smoothie, and that was the only meal I had all 3 days. So you can imagine being hangry on top of all of this. And I think I had some plain chicken broth and then just water the next day because I can't even have my seltzers anymore. But I digress. I'm getting off track. Test number 2 was that night at 8 p.m., which I didn't even know they scheduled tests that late, but that was my, yet again, another MRI. This one was with oral contrast. I had to drink 3 bottles of basically what tasted like flat, speaking of flat, of like flat Sprite. But that was an MRI. It said MRI of the pelvis, but apparently when they do that MRI, they're looking at all of your insides to make sure that everything is in the correct place, that they don't see any masses, that nothing's enlarged. So they're actually looking at all of your internal organs during that. And if you have seen my videos before, you know I have not had good experiences my last few MRIs. So this particular one was going to be done with sedation to begin with. And there was a little hiccup with that at the beginning, but everything ended up getting corrected and was fine. I must say, all of their staff, they're all so kind and so efficient. And if there is any kind of mix-up or mistake, they immediately address it. So I go in for that MRI. And again, I had to drink like 3 full bottles of what tastes kind of like really sweet, flat Sprite. And not, the best, but I guess not the worst. It was a little hard to get it all down in time. And it had an instant effect on me that I was not warned about or expecting, that made me think that they had started my bowel prep for my colonoscopy a day early. That's my way of telling you what the issue is without getting too descriptive or TMI here. But I had to instantly run to the restroom, and of course then I was paranoid the whole time I was in the MRI that was going to happen again. But that, I guess, helped, make the next day not as difficult. So that MRI was very lengthy. It took about an hour. And like I said, they look at everything in there. So by the time I was done there, that was a wrap. We went back to the hotel. Let's check out Home Sweet Home for the next couple of days. Got a bathroom. Okay, not bad. Microwave and coffee machine, neither of which I can use. Cool, cool, cool. Let's see what's under here. We got a fridge. Living in luxury these couple of days. Oh, I don't like that it has an adjoining room. Let's make sure that's nice and locked. Okay, we got the bedroom, the living room. All my crap. And then that is where I will be walking to for my MRI later tonight. Right over there is Mayo Clinic. So can't get much more convenient than that. All right, I've got a few hours to kill and I can't eat, so I guess we're gonna just read and relax, maybe watch a little TV. Which was right across from, well, you saw, it was right across from where I was at in Mayo Clinic. There's like a little path, so you could literally just walk right over there. You will be proud to note, well, I'm proud to note, that I neither projectile vomited, nor did I have some type of convulsion, pass out, whatever happened the last time I had an MRI. So everything went off without a hitch. That means that the sedation did its job. And I must say, getting an MRI there, totally different than anywhere else I've gotten an MRI at, including several hospitals. They really care about your comfort there. Like they've got your arms on cushions and padding so that you don't have to figure out where to awkwardly place them. They have nice comfy headphones that actually drown out the noise. They play your music of choice. They have a little fan going so that it feels like you're not stuck in a little tube. You feel like you've got fresh air blowing over you. You've got a nice warm blanket on. I mean, every maybe 10, 15 minutes, they check in, make sure you're doing okay, tell you about how many minutes until they start something new in case you need to take a break. I mean, I told them, I said, I don't think I ever want an MRI anywhere else again. This was a much less ordeal than any of the other ones have been. So that is one positive thing I can say. But like I said, let's talk about test number 3 now. So the next day, Wednesday morning, I had an early test called a swallow function test. In my mind, I wasn't quite sure how that was different than the esophageal manometry, since I was having to swallow while they were looking and monitoring. But apparently this is more of an X-ray where they actually have you swallow different things and then watch via X-ray, or would it be a CT? I don't know. Anyway, the stuff that they make you swallow is radioactive. I don't know how to explain it, but it actually, it's like barium or something like that, so that they can actually see it on X-ray, follow where it goes. And then after they do their various testing, which was really kind of weird. Again, I didn't know what to expect and I couldn't really find any information on it. You're swallowing the same type of substance or ingredient or taste. Like I said, I think it's barium, but it's all different textures. So the first time, the first one you have to drink is similar to water. So you're just drinking liquid that tastes gross for a sip or two, and then they watch that. And then you have something that's slightly thicker, maybe like milk consistency. Again, same taste, which is really weird to go through a bunch of different textures. If you're a texture girly, it does kind of give you the ick, because it's weird having things that are so completely different but have an identical taste. Not a fan. But other than that, this test was very quick, and it was not as unpleasant as the first one by a long shot. The next thing they gave me, I think, was like a pudding consistency. And then they put like a little piece of graham cracker on something with a pudding consistency. And then each time they have you swallow, and they take pictures and video of you swallowing so that they can kind of follow it down your esophagus into your stomach to make sure that it's, again, doing what it's supposed to do. And then after they get through all that, you stand up in front of the x-ray machine so that they can actually see all the way down into your stomach and not just to the bottom of the esophagus. And that one I actually have a clip of, which I found super interesting, and I'm going to insert it here in a minute. But I want to kind of explain what you're going to see first. So they just had me swallow, again, more of that liquid, but it was basically just kind of the water this time. So they said, okay, take a few sips. So I had to take a few sips, and then they told me, okay, now swallow. And filmed it going all the way down while I was standing up so that you could see it travel all the way into where it empties into my stomach. And what you'll see in the video, which she kind of explains, so I'll leave the audio in, but you can see how it travels normally down most of the way. And then when it gets to like right above my stomach, instead of continuing at that same pace and filtering into my stomach and emptying out, it kind of gets trapped, like right in here under my rib cage, which explains all of the pain and discomfort and bloating that I'm always getting under my rib cage, where it feels like somebody is squeezing me from the inside out. At least in my mind, it explains that now. So what's happening is it's pooling right here and getting stuck, and then gradually, very slowly filtering a little bit at a time into my stomach, while at the same time moving back up. So that's what's causing all of this damage. That's why my voice is getting worse.
Goes down, and then how it empties into your stomach. And if you notice here, it's taken a little while to empty. At this point, it should have emptied.
So it should go right in.
Yeah, and then there you see that kind of backflow.
Yeah.
And it's still taken. I tell you to swallow your saliva, trying to kind of kick it down. A little bit more emptied, but you still have some of that backflow coming up.
All right, so that was the clip of the swallow function test while I was standing up. That picture that I posted on the community post was one of the still photos before I was doing the stand-up portion. So I don't know, what do you think? Pretty interesting, right? I mean, I don't love that that happens, obviously, and it explains all of the pain and pressure and a lot of those issues that I have in my upper abdomen and all of that. But it did apparently tell them kind of more of what to look for when it came time for my next round of testing the following day. But after this one, I went straight into a consult with, it was a speech and language therapist, I believe. And she's the one that actually showed me those videos, went over it with me. And she gave me a list of foods that I should immediately avoid, as well as the names of some books or some good literature that I can do my own research on to figure out what I need to stay away from and what I need to have, which I am currently having my one and only cup of coffee allowed to me a day right now. So that's going to be a struggle. No more 2 to 3 cups a day for sure. One only. She also did want, along with the GI doctor, for me to have a consult with ENT as well there. So I am going to be scheduling that and probably more or similar tests. I don't know. But they want to make sure that the damage that they saw in the esophagus and those things, that they're not also present in my throat, because apparently the GI handles the esophagus all the way down to the pelvis, whereas the ENT handles the throat portion and the airway portion of that tract. So apparently some types of reflux can cause issues with the airway. They know that my vocal cords and my throat do have inflammation, so they just want to do the same type of precautions and testing kind of that they did for the esophagus there as well. So that is pending. But aside from that, the consultation went well. I actually already got my required reading that I'm going to be getting into. So as far as testing goes, that was it for the day. I was done, and unfortunately then began my bowel prep portion for the final day of testing, which I'm not even going to go into. Most people are familiar with colonoscopies. If they haven't had one themselves, they know somebody that has, and most have heard about the prep, but they just want to make sure you have a nice clean palate for them. So that is your duty, no pun intended, for that whole day before, is making sure that it's as clean as possible for when they do the colonoscopy. Which brings us right into day 3 of testing. I knew I was having a combination of a colonoscopy and endoscopy, which again, same as the colonoscopy idea, except they stick a different tube down your throat, so that they can look all the way into your stomach that way. And so they did both of those. I knew that they were going to biopsy at least a couple of areas, since the GI doctor had given me that heads up. But based on the results of my esophageal manometry and my swallow function test, they did add a few more biopsies. And then once they got in there, apparently they found a couple of polyps. So they biopsied those as well and sent those off. So they did collect all of that. Luckily, the procedure went well, and I was knocked out for that one for the first time, since I had to be alert and awake for everything else. So it was nice to kind of just go to sleep and wake up and be done with that. I will be honest with you, I was very surprised that my throat was not more sore, given all that it went through those 3 days of testing. But once I was cleared from that procedure, I was free to go. So I ate a quick little meal right in the cafe downstairs before we left. And then we headed back to home base. By we, I mean my mom and I, because thank goodness she came with me to do all of this. So now I want to get into what all of that testing told me, or told the doctors and then me, and what kind of happens going forward, what my next steps are. You get it. So let's just start back with the beginning, and I'll kind of work through. The esophageal manometry and swallow function tests did confirm extremely severe GERD, which is gastroesophageal reflux disease. One of those D's. I'm such a poet. And so it did detect very severe. I guess they grade it A through D. It's funny that they don't go all the way through F. Anyways, it goes A through D. C is moderate, D is severe. They said I technically was a C, but borderline D. So it's pretty significant damage from the reflux, which I kind of knew based on the amount of pain that I get, and the heartburn and the inflammation. So they do know for a fact that I have, moderate to severe reflux at the moment. That's another reason why they're going to refer me to the ENT as soon as possible. They want to make sure I don't have that restrictive airway reflux as well, since it does kind of seem like there's a lot of pressure and inflammation up here as well. So that is that, which they also were able to confirm after the colonoscopy, I should say, was mostly normal. There was nothing super concerning. They found a few irregularities, but nothing that they felt needed, to be followed up on anytime soon, or that was a current cause of concern or issues. So that's good. No sign of colitis, no sign of Crohn's, no sign of cancers, nothing like that on the colonoscopy. The endoscopy confirmed further damage. Apparently, the top 2/3 of my esophagus are generally okay, but the bottom part is defective. It's just not working, which is the flap that allows things to go down into the stomach and keeps it from coming back up. So after you saw that clip of the video and knowing that I have severe GERD, that makes sense. Luckily, none of the biopsies showed anything majorly concerning as far as like cancer. There were no masses. Nothing was enlarged or looked unhealthy as far as, my organs were concerned. There is, some damage, but thankfully no erosion yet or anything like that. So they did diagnose me with, in addition to the reflux, I also have what's called Barrett's esophagus, which is basically that defective bottom third part of your esophagus and a defective flap. Sometimes they need to use a pump to get it working properly. Sometimes it needs surgery. Most of the time, and what we're hoping for this time, is that with the medication that she's currently going to prescribe, that's a combination acid blocker and something to do with that same kind of pump inhibitor. I don't know. I forget all the terminology, but we are going to temporarily be taking that, which I am actually starting this week. So hopefully I will see some improvement right away and I won't need to, be chomping on Tums all day long. So we've got the GERD, we've got the esophagitis, and we've got the Barrett's esophagus. Were the 3 new diagnoses that I get to add to my ever-growing list. But the bright side is that when I have to follow up and have another endoscopy in only 8 weeks, if they do see sufficient healing, they can lower me to the absolute lowest possible dose. And then it kind of sounds like they might want to do another one after 8 weeks to make sure it's fully healed. But if it does look sufficiently healed at that point, they're comfortable with me no longer taking the medication and just trying to control it with my diet going forward and the exercises that they gave me. So that is some good news, even though they did find a lot going on and there's probably additional damage up higher once the ENT does their evaluation. Hopefully the combination of the medication, the exercises, and treating some of the other issues I have, hopefully my voice will start working better and it won't be as hard to speak and swallow, etc. So we already know that an ENT referral is in my immediate to near future. I know I had mentioned before that prior labs had confirmed that I am way into the osteopenia category and making my way slowly to the osteoporosis category, and that my bones have the equivalent of a 72-year-old woman right now. Not to brag. I'm, only 3 decades ahead of my time. But anywho, again, that is also reversible, and I can restore some of that damage to my bones once I am being able to do strengthening exercises, possibly some type of hormone patch temporarily, hopefully temporarily, and then, probably a calcium supplement as well, especially if I stop taking the Tums for my heartburn. So you can see we do have solutions. Good news. In more good news, I know I mentioned that I had started taking a preventative medication that was supposed to block and prevent my chronic migraines from happening, hopefully altogether, but definitely to at least make the frequency dramatically decrease as well as the intensity. And then I was also given a medication for if and when I do get a migraine. And in the beginning, the first couple of weeks, I was still needing the if you do get a migraine medication at least several times a week. Knock on wood, I am happy to report the preventative seems to have started doing its job, because it's been almost a month with no migraines. So I am hoping between the no migraines and being able to improve my reflux and some of the GI issues soon, that those will not be exacerbating my main underlying issue that they're still trying to figure out. And it will in turn not be overwhelming my nervous system as much, with as much pain from as many different systems as possible. So that is great news to me. The downside is that my GI doctor and my cardiologist, which I'm not sure if I mentioned, so I'll reiterate that in a moment too, but they are convinced that the main culprit is a connective tissue disease or connective tissue disorder that's autoimmune in nature, specifically on the rheumatological side. And so they're basically both my GI doctor and when I saw my cardiologist are both saying, look, rheumatology's got to have to either look again, retest, or look for some other stuff, because my cardiologist feels that my small blood vessel disease versus like what's typical when you see the type of heart issues that I have, which is the coronary artery disease from blockages. I don't have that. I don't have any blockages or anything like that. So he said I'm on the small blood vessel disorder side, which is, also puts me at higher risk for stroke, heart attack, those type of issues if it continues to cause damage. So he's like, you got to figure out what the autoimmune condition is so that you don't keep damaging your heart worse. And he gave me nitroglycerin to take for if I get really bad chest pain. But my problem is I don't know if I'm having chest pain because of reflux or if it's chest pain. So that's a whole other thing. But to have him be so adamant about that, and in fact, he even specifically brought up lupus or something similar, or something that attacks your body in a similar way, which, as you guys know, has been one of my main culprits in my head the whole time. But they haven't been able to confirm that yet. So my GI doctor said, based on the results that did definitely show that there was muscular defect. That was the other thing the esophageal manometry showed, is that in addition to that damage, my muscles are not working right. They're not contracting, relaxing the way that they're supposed to. And I know that's happening in my throat as well. So unfortunately, that's another what comes next. Because of the fact that there is that muscular defect, she said it's not necessarily a paralysis, but it does kind of freeze. And again, I can tell it's that left side that's the culprit, and that it will stop working or tighten when it shouldn't to prevent things from going down. So it's just like, it seems to be that it's muscular, which is why she's so convinced that it's a connective tissue disorder that's autoimmune, that's impacting multiple systems. So because of that, and because of the other GI issues that I'm having, again, without going into too much detail, they want to do the anal manometry, which is like the one that I had down my throat, but again, not down my throat, hence the name. You get it. I don't need to explain further. She said, the bright side is I would take that over the esophageal one any day, because you don't have to do any of that. Like, it's not like that painful, make you swallow and do all that kind of stuff. So, at least it should not be nearly as unpleasant as the first one. It should also be fairly quick. And then that will tell them if I have the same type of muscular defects there. That further proves that my muscles are just not working right, whether the way they're connected, the messaging and connection between them, how the hip bone's connected to the knee bone or the thigh bone, or that them bones, them body bones. Same thing with the muscles. And we already know my legs and arms are not working properly, or my back, or my abdomen, or my neck. So that will kind of help them narrow the focus of where to look. I still am, in my head, expecting them to say whether it's, weeks from now or years from now to confirm that I do have lupus, because it just all adds up and it just matches with everything else. And apparently lupus and MS go hand in hand a lot. So that would also explain the bands from the lumbar puncture and the other things that lean more towards MS than lupus. Unfortunately, they can't confirm either yet, so that does mean repeat testing on both of those fronts in the coming months as well. So that's another what's next on the horizon. And then finally, which is what I'm actually getting ready to start very, very, very soon, and that is the first thing that I've had any cautious optimism about, and that is a very intense 3-week full-time outpatient pain rehab clinic. I think that's the official term. But it's, like I said, it's a 3-week program. It's Monday through Friday from 8 in the morning until 4:30 in the afternoon. You get 1 hour for lunch, and the rest of the day is booked and busy. They incorporate, I think, yoga, but you do physical therapy and stretching every day, occupational therapy. I think they do biofeedback. You meet with nutritionists, the whole shebang. They review all of your medications, how they work together, see if there's any tweaks or changes that need made, see if there's any that they can wean you off of, to kind of come up with a plan for that so that you can be on the least amount of medication that you absolutely have to be, which I love. And then, other kind of coping techniques and strategies to go along with diet and lifestyle changes. So they kind of take a whole body approach, inside and out, and really try to give you the tools to manage your issues, even if it takes a long time to get those other necessary answers like the ones I'm waiting on. They also recommend this program not only for my central sensitization syndrome, also for fibromyalgia. It's actually recommended for lupus patients. So on the bright side, if I do have lupus, it might help me with that, those symptoms, and my fibromyalgia as well, which I also have if you're new here. Hi, I have a whole list of things wrong with me right now. So, and it's also recommended for POTS patients, which, it's another one of my shiny new diagnoses in the fairly recent past. So because of the fact that there's no specific cure for these, it kind of tries to address healing chronic pain, chronic fatigue, chronic illnesses by retraining your body's response to the signals that your brain is sending. So basically the way that the director of the program explained it to me was that each time I have one of these episodes, each time my legs get shaky or wobbly or don't respond properly, each time the doctor checks my reflexes and I have none, that's all deconditioning my body because it's not doing what my brain is telling it to do, which is further telling my muscles to keep going that way. So what they try to do is stop the deconditioning and start reconditioning so that you can hopefully eventually, get back to work, increase your functionality and your physical capability again, get back out in nature, start hiking again, those kind of things. And they are very confident that at the end of this program, so in less than a month, that I will see significant improvement. So, I'm going to keep you updated on that, because the sooner I get better, the sooner I can start even going out for overnighters, which I am so ready for. I am, like I said, very cautiously optimistic. I do think this is the first thing that's going to make a noticeable difference. And I think as soon as I see some results, that'll kind of boost my morale and give me the motivation to keep going. I'm also going to use the 3 weeks while I'm in this intensive program and I have the nights to myself completely alone and stranded to also work on things like journaling, coloring, just being more mindful and kind of present so that I can really get the most benefit out of this hopefully healing process. And as you can tell, my voice needs a break. So I will see you guys very soon. And thank you so much for watching.